Psychiatric section and term phobic disorder. Are you afraid, or are you fearing, or are you phobic? Let's discuss every of these terms and understand normally what does mean it. So everybody in the world can admit or not, but have some fears and can get anxious about certain things like a spider crawling on the ground or getting up in the front of large group of people. So in most cases people cope with those fears and confront them. But if they are more pronounced, these fears are more pronounced, they are called phobias. And of course, if it prolonged term of time, it is phobic disorder. Phobias are considered the most common psychiatric disorder that affects 10% of population, and phobias are extreme, often unreasonable and irrational fears of something, which could literally be anything like pyrophobia, which is a fear of fire, for example. It is unreasonable or irrational fears that get in the way of daily routines, work, and relationships, of course, because the patients with phobias might try to do whatever they can to avoid the anxiety and terrifying feelings associated with the phobia. There are three types of phobias, like specific, agoraphobia, and social phobia. Let's move on to the next slide. Every type of phobia in part. Let's start with specific phobia, which can be classified as fear of animals, fear of natural environment, like darkness, blood or needles, especially at the hospital, situational fears like fear of flying, and others. Agoraphobia, which is fear of public places, but has to do with being fearful in a public space where it feels like it might be hard to escape quickly and return to place perceived as safe. So it is unfriendly to be in a public spaces, and going home like something personal is very welcome. Social phobia, or overwhelming and persistent fear of social situations and social interactions with other people. So people with social phobia are fearful of being embarrassed or judged by others. Being embarrassed or feeling awkward in a social interaction from time to time is totally normal, but people with social phobias often feel anxiety for weeks that can lead up to events before they happen, and are afraid of doing common things in front to others. Phobia is a type of anxiety disorder, and patient may not experience any symptoms until come into contact with the source of phobia. But in some cases, even thinking about the source of a phobia can make a person feel anxious and panicky. This is known as anticipatory anxiety. So symptoms may include the following, like unsteadiness, dizziness, lightheadedness, nausea, sweating, increased heart rate or palpitation, shortness of breath, trembling, shaking, and upset stomach. Treatment. How about treatment? It exists and is applied. Psychotherapy, particularly cognitive behavioral therapy, can be super beneficial for patients. Cognitive behavioral therapy teaches patients to be mindful that their fear is irrational. Very important. And systematic desensitization might be used, where a person is gradually and systematically exposed to the feared objects. Patients first learn to identify the anxiety then they learn coping techniques, and less they use their learning coping techniques to overcome situations. The vast majority of patients can be treated using these tailored methods. So, teaching patient about object or things and expose to them many times easily for or get familiar and unafraid without any reason. Also, we can use medication like FDA approved or Food and Drug Associated approved paroxetine, sertraline, venlafaxine, escitalopram, fluoxetine, and others like tricyclic antidepressants, beta blockers, also used for panic attacks, and selective anticonvulsants like gabapentin, pregabalin. Thank you very much for your watching. Hope this video is useful. If yes, you can subscribe and click like. Have a great time.